Training, you'll learn about the main principles of infection prevention and control. These include hand hygiene, personal protective equipment, or PPE, and isolation precautions. After watching this video, your Bixel instructor will ask you to demonstrate hand hygiene technique and proper technique of wearing and removing personal protective equipment, and will assess your competency. If you complete the training successfully, along with completing the required vaccines, your instructor will issue you the Bixel card. Part 1. Hand hygiene. Hands are the main pathways of germ transmission during healthcare. When healthcare workers fail to clean their hands between patient contact, germs in their hands can be passed from person to person and spread infection. Hand hygiene is, therefore, the most important measure to avoid the transmission of harmful germs and prevent healthcare-associated infections. Hand hygiene is considered the main part of the standard precautions that are the minimum infection prevention practices that apply to all patient care. How and when to practice hand hygiene. 1. Alcohol-based hand rub. Duration of the entire procedure, 20 to 30 seconds. Wash hands instead when visibly soiled. How to hand rub. 1. Apply a palmful of the product in a cupped hand, covering all surfaces. 2. Rub hands palm to palm. 3. Right palm over left dorsum with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Backs of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers on right hand and left palm and vice versa. 8. Once dry, your hands are safe. 2. Hand washing with soap and water. Duration of the entire procedure, 40 to 60 seconds. How to hand wash. Wet hands with water. 1. Apply enough soap to cover all hand surfaces. 2. Rub hands palm to palm. 3. Right palm over left dorsum with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Backs of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing of left thumb clasped in right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. 8. Rinse hands with water. 9. Dry hands thoroughly with a single-use towel. 10. Use towel to turn off faucet. 11. Your hands are now safe. When hands should be cleaned. 5 moments for hand hygiene. Moment 1. Before touching a patient. Why? To protect the patient against colonization and, in some cases, against exogenous infection by harmful germs carried on your hands. When? Clean your hands before touching a patient when approaching him or her. Moment 2. Before clean or aseptic procedure. Why? To protect the patient against infection with harmful germs, including his or her own germs entering his or her body. When? Clean your hands immediately before accessing a critical site with infectious risk for the patient. For example, a mucous membrane, non-intact skin, an invasive medical device. Moment 3. After body fluid exposure risk. Why? To protect you from the colonization or infection with patients' harmful germs and to protect the healthcare environment from germ spread. When? Clean your hands as soon as the task involving an exposure risk to bodily fluids has ended and after glove removal. Moment 4. After touching a patient. Why? To protect you from colonization with patient germs and to protect the healthcare environment from germ spread. When? Clean your hands when leaving the patient's side, after having touched the patient. 5. After touching patient surroundings. Why? To protect you from colonization with patient germs that may be present on surfaces or objects in patient surroundings, and to protect the healthcare environment against germ spread. When? Clean your hands after touching any object or furniture when leaving the patient's surroundings, without having touched the patient.